Hi, I'm Dr. Laura Pfeiffer, naturopathic doctor, and today I'm going to talk about the importance of the timing when you get your hormonal blood work done. You wouldn't believe the amount of clients that I work with who bring me their blood work that they had done with their practitioner, and I ask them when they had it done in their cycle. They reply that their doctor just told them to go whenever. And so we're really left with no information in order to interpret what your hormones are actually doing, the clinical relevance of that information, and how we can go about creating a treatment plan. So the timing of your hormonal blood work matters. And I'm going to talk about when you're going to be doing the most commonly recommended tests that I give my clients in my practice and why. So I want to start with by saying the first piece of information in terms of blood work timing that actually doesn't matter is if you are in menopause. So if you do not have a cycle at all, then you're just going to go for your blood work whenever, and that is okay. However, if you are having a menstrual cycle, it is really important that we time it appropriately. When we are looking at hormones in your blood, we are looking to see how your hormones are cycling over time, and we're measuring that. So when I talk about the beginning of the cycle has estrogen. Estrogen is building your lining, it's developing your follicles, and it is working with other hormones to really set the stage prior to ovulation. In the second half of your cycle, we've presumably ovulated, and we want to confirm that by looking at rising progesterone levels. Now, depending what your goals are, I may recommend you get blood work at 2 times during the month. I may only recommend you get blood work at 1 time during the month. That's going to be person to person dependent and really depends what we're looking for. But if we are looking at all the hormones and we're doing all of the touch points in your testing, what we want to do is start with day 3 of your cycle. Day 3, like I said, is going to be the beginning of the cycle. Now, during day 3, you're likely still going to be bleeding. Now, day 3 is not set in stone. There is a little bit of wiggle room. You typically can go anywhere from day 2 to day 5 for it to be accurate information. Now, what does that mean? Day 1 of your menstrual cycle is the first day that you bleed. So, first day that you bleed, meaning first day of full flow. That is cycle day 1. If you tend to get a really, really light period and your period is very light spotting the entire time, then day 1 would be when that spotting starts. If you tend to get a little bit of spotting the day before and then your full flow starts the next day, then day 1 is the first day of your full flow. Then you're going to count that day as day 1 and get your blood work done between day 2 and 5, whenever your schedule can accommodate, because it's typically blood work. In those day 3 blood work, you are getting estrogen, also known as estradiol, luteinizing hormone, also known as LH, FSH, follicle stimulating hormone. You can also get other things, but right now I'm just trying to pinpoint what needs to be done on day 3 to day 5 or day 2 to day 5 of your cycle. Now, if you are looking for a diagnosis of PCOS, likely you're going to be looking at LH and FSH because we look at the ratio. You don't necessarily have to, but it's really helpful when we look at things like fertility, when we're looking at perimenopause, like I said, a diagnosis of PCOS, looking at LH and FSH and looking at the ratio between the two can be super helpful. FSH also tells us whether or not we're in menopause. So if that number is too high around day 3, that can give us some information as well. On top of that, you can also look at testosterone. It's not super cycle dependent, but I would add it onto day 3 blood work as well. And I would make sure it's a free testosterone, not just total testosterone, because then we know which testosterone is actually acting at the level of the tissue. Beyond that, I typically like to see a full thyroid panel. For the menstrual cycle, your thyroid doesn't actually have to look at it or be looked at rather at a specific time, but I would just recommend tacking it onto whichever blood work is the easiest and going fasted in the morning. Your thyroid values are going to be most valuable when you are fasted. They're going to be most accurate. The next test I look at is day 21 progesterone. Now, if you are somebody who isn't getting blood work done for fertility purposes, then I would typically just recommend you would go with the day 21 blood work because that's going to confirm ovulation and you can compare the estrogen to progesterone ratios. So you can actually get that estrogen done at day 21 if we're comparing it to progesterone. If you have any questions, Comment below.